Again, this is the chapter which I wrote in interventional book about stem cell 3 years ago. Okay, so what is the role of stem cell in cardiology in general? I'll just role of stem cell therapy in heart disease is myocardial infarction, ischemic cardiomyopathy, non-ischemic cardiomyopathy, can be used in intractable angina, in cardiac surgery, and congenital heart disease and microvascular coronary disease. Now, what are the issues with clinical trials of stem cell therapy in the field of cardiology? So far in cardiology, we have more than 300. You could see that the evidence in cardiology is a very, very good evidence because it has been tried in a clinical randomized trial. Some of them randomized, some of them not. So it is application in diseased persons. It's not animal, it's not investigational. So there are more than 300 phase 1 and phase 2 clinical trials. And we have one phase 3, which is more than 3,000 patients, called BAMI trial. This is more than since 2000, it's over the last 20 years. The result of these trials have shown mixed results as the studies have many differences. The problem in stem cells are these. Number one, the difference in the isolation techniques. We have so many techniques of isolating stem cells. Cells preparation technique. I'm sure those who work in stem cell therapy like Dr. Abdul Majid or Dr. Mazen or others, أعتقد Dr. Jawad Twage is around and he's very experienced. I have to admit that he's a good Iraqi orthopedic surgeon, I think, not plastic, and he has very good experience in regenerative medicine. So the types of stem cells used, the protocols used are different, the number of cells injected are different, the timing of cells infusions are different, and the route of infusion, the baseline ejection fraction is different, the patient clinical comorbidities, and the study design. That's why we have different results because of these issues. So for heart failure treatment, you know, the management of heart failure has extended the lifespan of patients population. However, all the management available does not reverse the disease process itself. Apart from heart transplantation, currently we don't have treatment, real treatment for heart failure. You could see it is like management of symptoms, little bit of prolonging life and survival, but the final and the only current available treatment is heart transplantation. So there is a clinical need to explore a cardiac repair with the stem cells. And many efforts aim to use the regenerative medicine properties of stem cells for strategies to repair injured myocardium. For nearly a century, the heart was believed and considered as a terminally differentiated organ and has no chance of mitosis or unable to replace any dying cardiomyocyte. This premise is no longer valid because we found a resident cardiac stem cells that can acquire the cardiomyocyte. It become vascular smooth muscle cell. It can become an endothelial cell. And these are currently present in the human heart, but it is dormant and it is in a small amount. So the role of cardiac stem cell in restoring damaged myocardium, spontaneous repair, as I said, we have minimal, and the regenerative response to non-infarcted tissue is not good. Spontaneous myocyte regeneration does not compensate for the loss of myocyte, and spontaneous cardiac repair may delay, but does not avoid or reverse the progression of heart failure. And this, as you know, what happens if you have myocardial infarction. If you don't do anything, If you don't do reperfusion, it will end up in fibrosis, and as a compensatory mechanism for the damage, the heart undergo remodeling, and the result of remodeling is enlargement and ending in decrease in cardiac contractility and decrease in left ventricular volumes and in ejection fraction. These are the techniques or the ways of stem cell infusion trials used. The technique started with either intracoronary infusion by catheter or direct subendocardial injection by a catheter direct to the muscle, but percutaneous, or direct by surgery. And currently, there are most of the trials are done using intravenous infusion of stem cells. And the Cell Surgical Network use that technique. But there are many techniques of intravenous infusion nowadays, using bone marrow, or induced pluripotent, or umbilical cord, or placental, and so many intravenously, because it is easily used and it doesn't need admission to hospital. And this is what is expected when you inject a stem cell. So the stem cell can differentiate into, it activate endogenous progenitor cells, which are dormant in the heart. It can differentiate into a cardiomyocyte. It can differentiate into vascular smooth muscle cells, forming the walls of blood vessels. It can differentiate into endothelial cells. It can differentiate, it can inhibit apoptosis, which is cell death. And also it improves the extracellular matrix remodeling of the heart, and it can induce a new blood vessel formation. I think Dr. Muthanna has indicated in the introduction of generations and types of stem cells. Now, since 2002 or 1, there are many types of stem cells used. In the bottom line there, skeletal myoblast was used, bone marrow mononuclear cells has been used, mesenchymal stem cell has been used, and CD34 positive and CD133 positive from the peripheral blood has been used, and adipose-derived stem cells. These are the first generation. The second generation is cardiac stem cells. I don't have pointer. And cardiopoietic stem cells and cardiosphere-derived stem cells, allogenic stem cells from donors are used as second generation, and induced pluripotent stem cells has been used. Now, the current generation or the next generation is combination of stem cell therapy, and that looks very promising. And this curve showing the beginning or the history of stem cell therapy, as you could see, 2000, and then different type of cell has joined, and now currently mainly it's using the cardiac-derived stem cells and adipose-derived stem cells. These are the curve. Okay, evidence. Do we have any evidence, or we are talking nonsense? I think in cardiology, I can show you the names of the positive trials and the name of the negative trials, and then the meta-analysis. On the left side, this trial has been done and it didn't work. On the right side, you could see this trial has been done, and we call it positive trial. So we have a good evidence of higher number of positive than negative trials. Do we have results? Yes, we have. This is a meta-analysis of 29 cardiac studies having 1,830 patients, having a short and long term of intracoronary and endogenously mobilized bone marrow stem cell, because these are the early generation in the 2012, I think, and that was in the circulation. Sorry, European Journal of Heart Failure, apology. And the injection was intracoronary bone marrow stem cell therapy post myocardial infarction, improve left ventricular ejection fraction beyond standard medical treatment in both short and long term. And this is the result. You could see anything to the right. These are some of the trial, 1, 2, 3, 4. And to the right side is better and favor stem cell, and to the left favor control. And as you could see, most of the results, they go to the right side of the curve. So there is an improvement in the left ventricular ejection fraction. So the meta-analysis of all these randomized trials has confirmed that cardiac stem cell therapy is safe, beneficial, had significant improvement in left ventricular systolic volume, diastolic volume, myocardial scar size, and ejection fraction. Some of the study also showed improvement in survival and death after stem cell therapy. Now, what is the role of stem cell therapy in heart failure? I'll take some tea. Okay, so these are the trials on the left. Is a negative trial, failed. There are 3 studies which failed. However, on the right side, you could see all these trials have positive results. Are you okay? Can you hear me well? Yes? Yes. Okay, just make sure. Now, we have also ongoing trial, which is the DREAM heart failure, the second one, NCT, concrete heart failure, CCTR, and concrete heart failure trial. The result of this trial are not ready, and we could see most of these new trials, they are using combination therapy of mesenchymal stem cell, and this is probably the future technique of stem cell therapy. Here we are. You could see it's very busy slide, but many of them showing a good improvement in left ventricular ejection fraction. And this is the type of cells used. You could see bone marrow cell, bone marrow cell, bone marrow, cardiac stem cells, and the doses of, and as you could see, the doses ranges between 10 million to 100 millions of cells were injected. And the route of injection is also different. You could see here in the middle, I don't know where's my pointer, in the middle here, this is either direct myocardial injection or intracoronary, subendocardial injection, intracoronary, intravenous. So the trial slowly become intravenous injections. Of course, this one, the one I showed you, is interesting. This is recent, 2018, circulation meta-analysis of randomized trial in heart failure. So 2018 is recent literature. This is if you combine the result of myocardial infarction and heart failure meta-analysis, circulation 2012. And the result is 50 studies. That's a good number of about 2,600 patients combining result in heart failure and myocardial infarction. You could see improvement in left ventricular function, and the benefit persists for follow-up. There is also a reduction in mortality, recurrent myocardial infarction, and even stent thrombosis. So that's a very good news for stent thrombosis patients. Now, as I said, this is the combined result. As you could see, all the results are significant. See the p-value 0.00001, 005, 001, 05, 04. So there is significant improvement in mortality, cardiac mortality, recurrent myocardial infarction, heart failure, and stent thrombosis. Now, it is even more interesting to see the result in non-ischemic dilated cardiomyopathy. If you could see the result on the left side, negative trial, not good, and positive trial on the right side. And this is the result. Again, Circulation 2018 meta-analysis has shown that if you could see here, again, you know, we have 3 years follow-up, we have 1 year, 3 months, and here the type of cells used, bone marrow mononuclear cells, bone marrow CD34 positive from peripheral blood, allogenic bone marrow, autogenic bone marrow, ischemic tolerated mesenchymal stem cells, and so on. The routes also different, most of them intracoronary, but you could see intravenous also has been used. And the result here, ejection fraction, improved, not specific, not significant, sorry, improved. So we have significant improvement. This is dilated non-ischemic cardiomyopathy. And this is just showing you example of CT angio, of cardiac CT angio. Ejection fraction before treatment 31%, after treatment 48%. Stem cells and refractory angina. We have meta-analysis. We have 2 meta-analysis and 2 studies. And these are the types of cells also used. Some of them intracoronary, some of them subendocardial injection. Different types of cell. As I said, this is the problem of we have so many types, then comparing result might be difficult. Conclusion of unstable angina. All the trials showed improvement in total exercise time post-injection, decrease in the angina frequency. Some trials have shown decreased mortality in the treatment population. Now, this is a very interesting topic, which I have to add. This is a recent study just published 2020, November in American Heart Association, which is a very respected journal, in 2019. What they took patient with the so-called, I mean, cardiologists would know that, we have the so-called microvascular disease, microvascular angina, syndrome X. Many ladies or women, middle age, come with typical unstable angina or positive stress test. You do angiogram, you tell them it is normal, sorry, you have microvascular disease. And there is no treatment for it. It's a very disabling angina. And this study was done on 20 patients. They did their angiography, were normal. They did coronary flow reserve, which is an objective evidence of microvascular disease before the treatment, and then they given treatment, and then they repeated the coronary flow reserve. And as you could see, the result is not there. Okay. Anyway, what they found that all patients, the 20 patients who were given stem cell therapy, they showed significant improvement in the coronary flow reserve, and they were angina-free. So this is a good evidence in normal coronary arteries microvascular disease. I will go quickly through the role in congenital heart disease. There is a direct cardiac application during cardiac surgery or tissue engineering. What they do in tissue engineering, they cell-based tissue engineering introduced by developing a stem cell seeded graft. So they take a graft from the patient, like a vessel or a patch or a scaffold. They decellularize, they remove the cells from that graft, and they put a stem cells outside the body. And then during resurgery, they will put it back in the body, like as a valve or as a conduit. So in conclusion, the meta-analysis of 19 studies in children using stem cell therapy for congenital heart disease, that stem cell therapy using direct transplantation to the heart or cell-based engineering has emerged as a strategy with potential benefit for patients with congenital heart disease. It can be used as an adjunct to surgical treatment, and we need to confirm that in the future setting of well-designed clinical trials. Role of cardiac surgery in general. Again, I'll go quickly. Heart valve replacement with regenerative capacities. Again, tissue engineering has been proposed as a possible approach to fulfill the need for valve replacement, which able to remodel, regenerate, and grows with the patient. As you know, now tissue grafting now, if you do graft, they will degenerate maximum after 10 years, and they will calcify, and they will become incompetent, regurgitant, and need to be replaced. So is there a role of putting a new tissue graft valve with engineered and added decellularized, remove the cells of the graft and seeded with stem cells, which have the potential of growing an endothelial cells and growing with the patient and heal and prevent degeneration and calcification and dysfunctioning valve. These are some of the studies which were done in cardiac surgeries using either allograft or xenograft and using different types of cells. So conclusion of role of stem cell therapy in cardiology. Nearly 2 decades of research support the idea that cellular therapy to promote cardiac regeneration and repair is safe and promising. To date, not many trials have been conducted with sufficient statistical power, and only a few phase 1 trials. Of course, you know the difficulty in conducting large phase 3 randomized trial. Nevertheless, multiple cell types have been investigated, and hopefully it will help for future. As technology improved, engineered cells and combination cell therapy, modified adult stem cells and using stem cell derivative like microparticle and exosome will help in the future. The use of engineered scaffold and repeated administration. As you could see there in heart failure, you might see the response might disappear after 6 months or 12 months. So nowadays people need repeated intravenous infusion, like in the neurodegenerative disease. And after several decades of experiments, stem cell therapy is becoming a magnificent game changer for medicine. With each experiment, the capability of stem cell are growing. We currently untreatable neurological disease have the possibility of becoming treatable with induced pluripotent stem cells. Stem cells bank are becoming increasingly popular, and with the stem cell therapy and all its regenerative benefits, we are better able to prolong human life than any time in the history. The last couple of slides, if you allow me, future prospects. The ideal candidate donor cell for myocardial reconstitution is a stem-like cell that can be easily obtained, has a robust proliferation, low risk of tumor formation, low risk of rejection, differentiation functionally into normal cardiomyocyte. The use of stem cell for heart disease is complicated and still poorly understood because the reason I mentioned, and we require a standard protocols for characterization. The considerable advance in our current understanding have shown that stem cell therapy is safe, moderately effective, mediated by indirect paracrine. Oops. Never mind, I think I am done here. Thank you so much.